So I have always been keen interest. I had always had this keen interest in pursuing Psy.D program because this is something, as you know, Psy.D program being a scientist and a practitioner course, and I had no clue that I would because MPhil exams, as you know, and Psy.D exams for RCI are pretty tough and they are very exhausting. So I just filled in for Psy.D program and I just crossed my hands, prepared what all I had, and I think so I was lucky. Hi everyone, I am Saatvika Parashar. So I have done my graduation from Delhi University, Marcus College, and did my post-graduation from Punjab University from the department itself, the Department of Psychology. And currently I'm pursuing Psy.D program from Amity University, Noida. And basically I have been in this psychology field for like 5 to 7 years. I have interned in various hospitals, various centers, hospitals like AIMS, RR Hospital, RML Hospital, and I've gained a lot of experience in clinical field, and that's how I gained an interest in pursuing clinical psychology as my PsyD course for clinical psychology. So I have always been keen interest. I had always had this keen interest in pursuing PsyD program because this is something, as you know, PsyD program being a scientist and a practitioner course, and many people who have completed their MPhil, they generally go for PhD higher course, that is PhD, and then further on they would pursue PhD. But this PsyD program is one where it is a 4-year course, and it just sums up, and you can do your MPhil along with your PhD. So that is why I always wanted to pursue my PsyD course. I had plans for abroad, but because COVID happened, everything changed, and they had stopped taking like students from overseas. So my options became very narrow, but still I filled up the form for Amity Noida, and I had no clue that I would because MPhil exams, as you know, and PsyD exams for RCI are pretty tough and they are very exhausting. So I just filled in for PsyD program and I just crossed my hands, prepared what all I had, and I think so I was lucky. It was very tiring. It was exhausting. There were times where I would give up myself, but then, as you know, you were a psychology student. You need to just, the self affirmations are very important. That time self affirmations worked for me, and you had a good support. So family is a very important. And along with that, I had UPS. So I used to do question papers and online. Used to prepare a lot, reading materials I used to get from sir, and I used to attend classes. So that is where I felt connected, and it helped me to prepare for my syllabus, for my entrance exams. And this was constantly, it happened for a very long time, and it was just 1 year of constant coaching and consistently working, just one topic a day, maybe not grasping too much, but just making my targets as very small as that. Yeah, I'll just stick to one topic a day. That's it, nothing else. And just revising and, doing question papers of previous year, which therefore led, into this, at least, achieving a particular goal of, MPhil exam or PsyD exam, cracking them. Yeah. I remember I used to make a table, from taking all of these question bank that we used to get from Sir through online mode, and also I used to refer to the previous year UGC question papers, and I would just make these lists, how many questions are coming from a particular area. So like as an MPhil or a PsyD for MPhil and PsyD exams, you must know that questions from biopsychology, questions from clinical, abnormal, statistics, these are very important. for especially for PsyD people who are pursuing PsyD or want to pursue PsyD program, statistics is the main tool. There'll be a lot of questions asked for on statistics, research methodology. So prepare that very well. Biopsychology, that will be very, it will be asked in great detail. So I think so. I just made these plan, and stick to it. And I used to, just as I told you earlier, just stick to one topic a day because, as you know, covering bachelor's and master's syllabus is a lot, and to do it in one day, it's not possible. But if you take it bit by bit, it's definitely you're able to pass that barrier of these entrance exams. Yeah. It's very important. See, I for a very long time, since COVID struck, we were having online classes. We were having online. There were online test portals that was put up by UPSC, and we were also referring to online study material, right? So we, in some way or the other, we were affected by it. So we had no problem, giving an online exam. It was very easy to us because we also had a practice mock test on UPSC portal. So in a way, it acquainted us. But it is very important for people who are used to on offline exam, and people who are trying to give their best and trying to understand the online mode. Is just try doing some mock tests and online test papers, reviewing them, and just seeing your score, because that is something that will learn, and you will learn and you will practice, and through practice you'll be able to answer these questions properly, and you'll not fumble, or you might not get confused or panic at that moment when you are prepared, when you are giving an online exam. Okay, so I'll just give you a brief info about what the PsyD program. It is basically a clinical psychology doctorate program, and PsyD is a 4-year course. So it is a practitioner scientist course, and basically it is mostly oriented towards practice along with you are doing your research work. So if you take it in the gist, it is 2 years of MPhil and 2 years of research, and along with that there is practice going on. So you go to different setups, like clinical postings take place, very similar to MPhil, but also you need to understand that inside you are constantly reviewing various research papers. You are keeping yourself in the loop of what are the new researches are taking place, what are the new therapies that are coming up, and developing and understanding into these research aspects. So also looking into the practice field, how you use different tests for different mental disorders, and how you try to diagnose them and work around them. Um, the main thing that you need to understand in this Amity course of PsyD program is basically there are various postings that take place. Since Amity does not have its own hospital, so there are various postings that take place in various setups. Like we have postings in RR Hospital, Air Force Hospital. That is the government setup. DDU, Janakpuri Super Speciality. Then we have postings in private setups, like for Nasanpuram, Perfect Minds, and in public government and public sectors like NIMH. So basically, these are various hospitals that are they are particularly exploring one particular field. Like one is for just children population, one is from adult population. So it gives us a diverse understanding of different population, whether it is child or adult population. And through that understanding and through that practice, we gain an insight of what is the field that we would like to pursue, or what one would like to pursue for their research work, or anything of that sort. So through that, we get an understanding that it's a really good it's a really good course that is there in Amity Side. So in Amity Noida, yeah. I felt, since I was part of UPS education, So I refer to various question papers. And the mock test that they had provided us. And I think so that was the last tool that we were going through, because as you know there is a lot of syllabus to cover, and it is totally extensive. And sometimes we ourselves don't know that what all to cover. Sometimes we get just left off. But the mock tests that they provide us, and the question papers, and they give us a trick and what are the questions that can be asked. So that is the main trick, to do a smart act. Rather, it's very important to do a smart study as compared to just a tedious study. So it's always good to review question papers that are from UPSC or from UGC net. Review them. If you are not in a mood to study, just try attempting these question papers, and somehow you get a hack about how these questions are asked. And apart from questions being asked, you'll come to know that what are the highlighted topics that are generally asked. So from there you can get a hint of uh, going about and preparing for your exams. Okay, so since COVID happened, and there was a time where I used to go for postings for a month or two, and then it stopped, and it was mostly online. Online. And for that period, we used to go for postings like for in adult centers like Perfect Minds and DPC and other people. There were other students would go in different centers like Pune Santolan or DDU. But that since that happened, since COVID happened, and there was a second wave that struck, so all the centers had stopped, taking in many cases, and there was the flow of the patients were very less. So we were continuing through online mode. In that case, our faculty were with us, and they were teaching us. On Thursdays and Fridays, we would have our classes, and we would, they would teach us various disorders, and acquaint us with their various therapies that happen, and how to go about, in dealing with any particular case that we come across. And then Thursdays, Fridays, also we would have our research, a journal club. A journal club would be where there would be a person who would be presenting a research paper, which is in a way very relevant in this today's scenario, and just it comes about it is basically the relevant researches and relevant therapies that have been taken, to improve the interventions and to improve a particular disorder, and how to embrace that. So that is there. Yeah. So Amity campus is basically it's an amazing place where there is an online with various books. There are, as Amity as professors and faculty, they're always in constant contact with us. They're just always guiding us and trying to mentor us, in whatever way they can do that. And then they also provide us with various understanding of what are the relevant disorders that are upcoming, and what are the relevant interventions that could be given. We are in constant support, and we are in constant under constant guidance with our faculty members. And there are 7 faculty members who are taking care of the Psy.D program. Since Psy.D students are PhD scholar students, so we are constantly under guidance of our HOD, that is Dr. Dweep Chand sir. So yeah, and also Amity as campus, it's really beautiful. Apart from that, it is diverse, and it is amazing to know that there are so many researchers that have taken place from in Amity Clinical Psychology, and how brilliantly they have worked in different fields, and which is very interesting to know that this university, I never expected that it would be that great. But yeah, it has definitely changed my perspective on Amity. Yeah. Okay, so Amity in university, since it's the RCI course, so RCI, in our batch there were only 3 seats available, and the course structure is like for 4 years, and the basically the student who is applying for PsyD, you have your letter of recommendations ready from the university, migration certificate. Apart from that, you need to have, if it is possible, if you have any interest in research work, just make sure that you have done enough researches and masters, so you can send out, the researches that you have done or presented in the conferences, the national or international conferences, and you can show it because it adds up in during the admission process of Amity PsyD program. Also, there's one thing more important, that the fees is a little bit higher, so it's around about 1.85. So, but there are also scholarships available for people who have difficulties in paying for fees of Amity, so then they can go for it. But a PsyD course is always, I would like to say in the last, that PsyD course is an extensive course, and it is serious. It can be very it can be very difficult and overwhelming. But at the end, I feel that that experience is important, because when we are entering into a as a practitioner outside the world, we will be facing a lot of difficulties, and if we have gone through that process of grilling and constant guidance from our mentors, it will help us in in understanding the population much better, and reviewing cases in a much better way. Yeah. Of course, semester would be around 1.865 to 85 lakhs. So that is the range that it would go. And it, as you know, because with the years, it slightly changes. So it varies from 1.6 to 1.85. Make sure that you have your letter of recommendations ready, migration certificate ready. Along with that, make sure that you have research papers that either you have presented in international and national conference. Along with that, if you're really keen, have a keen interest in joining PsyD program, it is an extensive course, as I've said it earlier, and it is highly tedious, and it is it will it will be a little bit difficult to process a day, one day at a time. But then at the end, these small experiences with our mentors and with our supervisors are important, because as we will be dealing with a lot of cases that are coming across, and we will be dealing with extensive population, and we might not know various disorders. So that is an important task, that we get proper guidance, and that guidance will be given by our faculty members. So that is important. Every day would be difficult, but I am sure that you will, come out of it. Yeah. My PsyD course, I was probably think of opening my own practice and also working in a government setup, and also acquainting, providing various workshops in various fields, in various organizations, and basically running around awareness programs for mental health, and also working in the field of childhood disorders, and and providing proper interventions to the families, and to the parents, and to the child, and in a way just making a beautiful place, so that mental health is no more a taboo, or it is not any more a stigma, that is and just trying to remove that stigma that is attached with it, and which is still prevalent in India, and just aiming to just remove that stigma. Right. Take care.